episode of the Namibian's Heartbeat discussion, where we talk about all things related to health. Today, I am joined by our journalist, Timo Shihepo, and Dr. Flavia Mugula, who is a physician in internal medicine and the founder member of the HIV Clinician Society of Namibia. Today, we'll be discussing the effect of COVID-19 on access to health services. As I said, I'm joined here by Timo Shihepo, who is a freelance journalist who covers a range of subject area, and Dr. Flavia Mugula. To my guests, welcome. I'm happy you could join me.
Thank you, Arlana.
So just to start on the subject, talking about the effect of the COVID-19 pandemic on access to public health services. This topic was inspired by a story that you wrote. So I'm going to have you take our audience through it a little bit. Just give us a little bit of context of the people you talked to, the experiences that they shared with you, and we'll move from there.
Good evening, Arlana. Good evening, Doctor. Good evening to the viewers. Yes, the story was to investigate how other patients are being treated or neglected at the time of the COVID-19 pandemic. How the story came up because the economy was already not doing well, and then it was hit severely by the pandemic. And then we thought, okay, is government still giving equal access to the people who are being affected, not necessarily by COVID, by other diseases as well, like say malaria or hepatitis E. So we thought, let's go around, let's investigate, and I'll give more information as we go.
Yeah, well, there's definitely no denying that COVID-19 has strained our health systems, and that's globally, all over the world. So Namibia is no exception to this. Dr. Mugula, let's weigh in from you as someone who works in the industry, who has the expertise. During this time of the pandemic, what have you observed? What has it been like on the ground in terms of people's ability to access health services?
Okay, thank you very much. You've already pointed out that it's a global problem, and Namibia has not been an exception. But what I have to say that as soon as it was announced that there is a pandemic, the Namibian government moved quickly to start administrative structures in place for the arranging for the prevention and treatment of people affected. Because we are dealing with a disease which had no cure and it only needed special support. And we know that there was a lockdown where there was restricted movements except essential workers, who are mainly health workers. And this restricted movement would affect patients who needed care at the hospital for various reasons. We have patients who we call the cold cases, like they have high blood pressure, they have diabetes, asthma, and they just need to pick their pills. And some of these patients were affected, but the government quickly put in structures at the hospital to give bulk supply for these patients, so that when they turn up, they are not given 1 month supply, they may be given 3 months supply, so they don't need to be coming to crowd the hospitals. And many of these patients did not need to see a doctor if they are fine. They would go straight to the pharmacies, and the pharmacies would issue the medications. So, but at the same time, there were other programs which were likely to be affected, like the vaccination programs. Hepatitis was mentioned, hepatitis E. Surprisingly, hepatitis E, the spread of hepatitis E was quite limited during COVID, because it had a COVID prevention programs also had a beneficial effect on the spread of hepatitis E, which is spread through contaminated vessels and hands. And now we know there was this strict hand hygiene, social distancing, and that one, there was a dramatic fall in the cases of hepatitis E. But now the challenge are the vaccinations. Children who need vaccinations regularly, some of the elderly people need vaccinations regularly. You find that some people could not turn up for their vaccinations. And some of the programs like tuberculosis were affected, because as we are aware that COVID is a stigmatized disease, and when someone has a cough, they feel like if I turn up at a facility, they are going to lock me up and check me for COVID. So we've seen a fall in TB cases because patients are just simply not turning up for screening for TB. But as much as possible, the government organized that all clinics should keep running to a certain extent to address those cases which, if they are not seen timely, they will accumulate and become quite severe. So the normal emergency was still continuing on. The outpatients were restricted, but they were still continuing on. And some of the cold cases we call like for surgery, which could be postponed, like someone has had a problem for 2 years, it's not giving any trouble, it just needs to be corrected at some point in their lives. Those ones were restricted. There's been a lot of discussions and a lot of groups within the hospital structures, within regional structures, and also at a national level to monitor and survey that patients get access to care in a timely manner.
I'd just like to go back to the point that you made about hepatitis E cases slightly going down or being controlled because the prevention is somewhat similar to that of coronavirus in terms of sanitation and that kind of thing. I mean, on this basis, the health minister also, Timo, as you mentioned in your story, had said that these claims that the other areas were being neglected was sort of baseless. Can you talk us through what that conversation was with the health minister and just contextualize his comments for us?
Well, thank you, Arlana. We went to the Kahumba Kandola informal settlement in Horeha, in the outskirts of Windhoek, and we were speaking to the people, and there were quite a number of people there who were infected by hepatitis E. They were obviously saying that they felt neglected by the government because nobody goes there to see how they are really living. There's one tap shared maybe by 30, 40 households. So the minister then said what the patients are not neglected, or the people are not neglected there. But if you go there and you see for yourself, you realize how the former settlement is, that it's called Kakumbakanto, as I said before. And as I said also that maybe one tape is shared by 30 households. Now, you ask yourself now to say, if they are not neglected, how come 30 houses, 40 houses share one tap water? And also the fact that the councillors, they hardly go to the people and talk to them and ask, what do you guys need? If you go there, you won't find toilet facilities. People have to dig themselves. Imagine either dig their own toilet facilities in a mountainous area, you know, Windhoek is a mountainous area, or they have to use a riverbed. The pictures are there, we have them, the videos are there. Hopefully they will be published soon. But again, when I spoke to the minister, he said, no, the people are not neglected. As Dr. Mugula said, that the way to prevent sort of corona is the same way as hepatitis E. Well, it's true, but the truth of the matter is that the facilities that can help prevent hepatitis E, they are not at that place that we visited. And imagine, this is just one place that we visited. There could be other places that are also people are struggling with other diseases, not just hepatitis E. Yeah.
I mean, I know that also, you know, around the world, just in terms of health services in general, a lot of resources had to be diverted from various areas of healthcare and health services. And I think, Dr. Mugula, you can probably speak on that a little bit. In other countries, you know, our nurses were pulled from other sections of the hospital to now deal in the ICUs. Has this been a similar situation in Namibia?
Yes, Namibia is not different from other countries because the ministry created new facilities to take care of patients who are affected by COVID, who are positive. And that means there was several COVID wards, like I can talk for Windhoek. We had a ward where there are people who have been screened, high suspects, not yet confirmed. And then we had a ward for those who are confirmed, but they are not critically ill, but they are quite sick. They need oxygen. They need a medical person to check them every day. Then they had to create a COVID ICU so that they would not be mixed up with other patients. And that means that nurses, equipment have to be mobilized. So the government gave some short-term contracts. There were adverts for new staff, and they were quickly recruited. Some of the young nurses who had been unemployed were drafted into the health services at a rapid rate. And then there had to be training. So the government started a series of training, which also took the senior people who would be managing normal programs into training programs of COVID. Some of the senior specialists, senior medical officers were pulled out of the general work and specifically allocated to managing of COVID, because the emotional, psychological, physical, as well as the health risks of COVID could not be underplayed. The fact that it's an acute illness, the government had to reduce the impact in a rapid way so that the community could not panic.
Yeah, and I think, Timo, also in your story, there was mention of patients who would go to the hospital and would need certain treatments, and all that would be said is, you know, the staff is working with the pandemic-affected patients right now. Yes. Can you tell us a bit more about that?
Yes, we spoke to several patients, especially the ones at the cancer ward, and they too felt neglected. There was one who was sent to, who was actually suffering from penile cancer since 2018. But he believes that the pandemic has affected the way of usually how he used to be treated at the hospital. He said when he went to Katutura Hospital, he was told that the nurses or the health officials were busy with the pandemic, so he must come back later. Then he went to the north. And unfortunately for him, the country went into lockdown, so he couldn't come back to Windhoek. And he's saying that he couldn't access the health facilities in the north for some reason. But then when he came back again, he said it was a bit tough to, when the lockdown was lifted and when people were still able to move from one region to another region. When he came back to Windhoek, he said it was a bit tough because he didn't know where to go, and when he went back to where he usually get help, he couldn't find that specific nurse, and then he said he had to maneuver his way to the pharmacy to get medicine because he said he was really in pain. The other one said was transferred from Hobabis hospital, also suffering from cancer. He was transferred to the Central Hospital. He said all he gets is an injection when he's in pain. He feels that the pills or the medicine they are not available in the hospital, and just like others, he feels like he's neglected. It was a pity because when I was interviewing him, he sort of also didn't know how cancer actually works, because he started then asking me a lot of questions. Then I had to get him a health official to really explain to him. Well, so those are some of the things why the patients feel like they are neglected. Yeah.
Actually, on the point of the medicine, pharmaceutical drugs, there was a huge issue with that, especially when we went into lockdown. I think Dr. Mugula, you can probably tell us a little bit about what the difficulties were with that. Of course, borders being shut, issues with transportation, but just how that strained the government even further, and how, of course, it just made access for people also more difficult.
The thing is that some of the patients were able to travel during the period of lockdown. There were official transporting patients by government buses from the regions to hospital. like Windhoek, where there is a referral hospital. And some of the patients came privately, and there was a roadblock where they would ask you your reason for traveling. And I know that some patients went through, but it was a very difficult moment for many of them, because there was a lot of lines of people at these points, and some of them could spend like 6 hours waiting, and which was not good for our patients. And then the supply of pharmaceuticals and other things were strained. Different types of pharmaceuticals were not available in time, and doctors, pharmacists had to quickly create groups to attend to those special needs, so that if someone realizes that at Cathedral Hospital they don't have this, then the pharmacists at Central Hospital could be having access and supply it. The main reason was that, as you've mentioned, the borders were closed. So these trucks that were supposed to bring in medications were moving. They had to be screened for COVID. Some of them had to go in quarantine before they could bring the medication. So the ministry looked at that and brought in several advisors to truck companies that they should deal with, like, drivers inside. One driver hands over the truck to another driver who has been living in the country. So the other one can be in quarantine, but the medications are moving. And so there was a rapid response from the medical stores, from some of the truck companies. They were able to reorganize and make sure that medications are moving. But it was also a challenging time, because the supply of medication of Namibia is depending on South Africa.
Absolutely.
And South Africa has their own laws at that moment with regard to movements, the internal movement in South Africa. So also that affected the drivers. But at the same time, there was also another challenge that had happened, that most of the medications used to come from South Africa, but for another reason, South Africa put in some laws about exporting medications from their country. And Namibia had to go through those new laws. And at some point it was difficult that the government started procuring medication from Brazzaville, Congo. Now that was another route which was not very easy to negotiate during the time of lockdown. So there were many things which affected. But at the same time, pharmacists worked hard to see alternatives. You are on these medications, what alternative can be available for you, and things like that.
Dr. Mugula, could you tell us a little bit about if you have an idea of which medications we had to now start procuring from Congo?
I'm not so sure, but most of the medications, actually, that's what I was told, because we were wondering what is happening, because it was also affecting the private sector, actually. So you'd call and they said that medication is out of stock, the order is already on, but it will take a bit longer to get that particular medicine. So it looked like it affected a lot of medications.
I'd be curious to know, though, where we are now. I mean, we're coming up on, I think we're on about week 48 or week 49 of being in the pandemic cycle. So how is Namibia faring at this moment in time? A lot of, the regulations have been lifted, so movement is a lot easier. How are we doing now?
So as you are aware, we've had two waves. The first one happened somewhere in last year, somewhere in May. And then the bigger one, which came in November, December, and January. So there was some limited movements, but not as severely as the first one. When there was a complete lockdown, it gave the government time to put structures in place. And because if they were facing cases, there would be no time to do anything. So during that time, they were able to put structures, get personnel, train them, and go through all the necessary logistics to prepare. And the second one came during the Christmas season, and that one was tough, because many of these healthcare facilities which were equipped to take care of COVID were flooded with patients during that time. But now the cases are dropping, which is quite good. So I think Namibia has been doing quite fairly well. The mortality also has dropped. The one thing which has helped us a lot is that with globalization, access to internet, all the studies and the research which are being done in other countries are immediately available to all the health workers. And the care of COVID has become a global concern, such that normally we would pay for that information, but there's been an agreement in the health community around the world that all information on COVID should be free. So whatever journal, whether it's British, American, Australian, once a study comes out, it's easily accessible to all health workers around the world. So that has been helped us to make operating procedures and protocols in time, so that if a medicine has been proved to be effective in Britain, the next week Namibia is also using it.
Yeah. In terms of access to information, though, I know that all COVID info has been made free, I think, for everyone, not only healthcare workers, but for the general public. Timo, based on your groundwork, do you feel like the people in the more informal settlements have access to that information?
Okay, thank you, Arlana. Two things. Access to information and also access to basic facilities. But let me speak about access to information first. At first, nobody knew in the world what COVID-19 was all about. I feel like lockdown, although it really affected a lot of people, I think it helped us, everybody, most of the people, to know what we need to do and what must be done once you are infected or your family member who is infected. I think the information was spreading well. I don't have evidence, but I think a lot of people got the information because lockdown helped people to stay at home instead of being at bars or at work. Then you miss out the information, because the discourse started spreading around because people would be most of the time at home. So in terms of information, I think the government did much better. But of course, more can be done. Now, if you allow me, access to basic facilities.
Yeah.
What came out of the story was also to highlight that when we say neglected, when the pandemic struck, the people or the street kids, they were taken out of the streets. They were put in makeshift homes. They were put at stadiums. It means that government can actually do this, can actually help people who are suffering, people who don't have homes. And COVID-19 actually exposed government to say, yes, you can, because people are sleeping under the bridges. People don't have food. But if you go to the Komasta Stadium today, go to Katutura Stadium, there is the Katutura Youth Center. There is like tents for people who don't have permanent homes. If you go to the informal settlements, some of them, they've been given tanks, access to water. They were given food during lockdown. It actually shows that government can actually help the people who are needy. It just doesn't want to do it.
Absolutely, but of course we also have to take into consideration that all of that help came with, a greater deficit, which of course we want to help people. People need to be helped, but I think it becomes tricky to sometimes go beyond that deficit unless it's an emergency. I mean, we can discuss that further and debate it, but it is a bit difficult to navigate on the economic side, I think.
Well, if we are going to say that it's difficult to navigate because of the economy, Namibia's economy was doing really well, maybe until 2015, 2014, but still, we never gave a helping hand to the people in the streets. I'm sure if we had started earlier, we would have had fewer people in the streets by now. But now people will say, no, it's impossible, you cannot take everybody from the streets. But when COVID-19 struck, it means the government actually did it, although the government didn't have enough money. How was that then possible to do it? Because what happens then after say COVID-19 is over? Do we let these people go back to the streets? And It's gonna be, when people sleep under bridges, it's a ground for diseases, breathing diseases, and it can put a strain on our health facilities.
Yes. Dr. Mugula, what are your thoughts on that sentiment that Timo just shared?
Yeah, so he has got a big hope. He's a positive person.
Yeah.
He thinks COVID will be over. I don't think it will be over. COVID will continue circulating in society like how flu circulates, you know.
Okay.
And the masks, hand sanitization is going to be the new way forward, you know. And there's got to be plans for these people who are living in crowded conditions, because you've pointed it out, you know. The thing is that it's a responsibility of government, but it's also a responsibility of local authorities, you know. Look at the city of Windhoek. These are falling under the city of Windhoek, which has got a program of sanitation. And what have they been doing about it? When there was hepatitis E outbreak, the city of Windhoek was tasked, and we don't know how far they handled it. So COVID has just shown us that the basic things have to be in place, and they will have to address that. And the story of the street children is just starting, and they'll have to look into it, because COVID is not going to go.
All right. Does anyone have any final thoughts that they would like to share in terms of, how we're performing with people having access to health services? How can government perhaps do a better job despite the pandemic? Because as Dr. Mugula said, it's going to be around, right? So one thing cannot fall by the wayside while one thing is prioritized, when this is going to become part of our natural way of living, basically.
Yeah. Well, I had hope, I have hope that COVID-19 will go away, but obviously she's a doctor, and how she has articulated it, I think, is something that to ponder on myself, to say that, but yeah, COVID might be really here for a very long time, right? And if it's really here for a long time now, it means that government is either going to continue forking out money to keep the people in tents at the stadiums, or it will let these people out. Then COVID-19 continues spreading. It means again you have to take money from the budget to accommodate these people, like to quarantine them. So I think it's a battle then to say, okay, will government keep the people in the stadiums? For example, the street kids. Will it continue providing? Will it have enough money to give masks to the health workers, protective gear to the health workers? Will it have enough money to budget for other projects that are not health related, and while keeping our health sector still intact?
Yeah. Dr. Mugula, do you have anything to add?
Okay. Yeah, on the other hand, if the vaccine works, it will reduce the cases dramatically.
Right.
But you need to vaccinate 70% of the population. So they are first going to most likely start with those who are at risk, like health workers, elderly, and people with serious medical conditions. But the time to complete to 70% will take some time, because even a country like America, they've not even come to a quarter of the population since they started vaccinating. The cost of the vaccine is very high, and the logistics are still complicated, and we are being challenged by the variant virus which is coming up to know whether those vaccines will really work. That's why I thought that at the end we are going to live with COVID for quite some time.
We actually have a question here from one of our viewers that I'll just read, and we can weigh in on that. So Jason Polis asks, how can we use artificial intelligence and technology to help reduce hospital capacity by operating as a possible filter and keeping those with moderate symptoms at home? And how does it benefit the health workers? So I think the question is a little bit twofold. Let me break it down. Let me break it down for you.
How can we use artificial intelligence and technology to help reduce hospital capacity by operating as a possible filter? That's number one. And then keeping those with moderate symptoms at home so that it can benefit, and how does that benefit healthcare workers?
Okay, we know that COVID causes mild symptoms or no symptoms in some people, and this is up to 80%. Then around 15% get severe symptoms and 5% become critical. So the question is there enough information going around for patients to know that, okay, I tested positive. If I don't have symptoms, I don't need to rush to hospital. I just be self-isolation. I only have flu symptoms and a slight cough. I took a Panadol and the fever was fine. I can sleep and I can take personal care of myself. So that's the information which can be on the social media, where that information was given initially to health workers, meaning that it was like as if the COVID positive people would turn up, but many of them don't even turn up. But I think at the time of COVID testing, there's now information that goes through the cell phones. So with that information, there should be more information of which category you are in. And once you realize you are in this category, but sometimes you move from one category to another, especially to become severe. You may start mild, so this person needs to know that if I get short of breath, if I feel I can't get out of bed, or I need assistance to the bathroom, I'm becoming quite severe, I need to go to the hospital. And also it should be a two-way direction, that we know these people who are positive, they should receive a call from a health worker or a message. How are you feeling? If you feel you are too hot, if you feel you are having too much diarrhea, you need to come in. Yeah, something like that. Yeah, but it's not easy because the health workers are busy taking care of people for them to be able to reach out to the patient.
And just your final thoughts on that, Timo?
My final thoughts are just to say that we actually have to help government for us to maintain or at least prevent the spread of COVID-19. As we have already said, the economy is really down. Government can't really do it alone. It has been really trying to give out information, but now walking around, people ask you, if you ask them why you're not wearing a mask, they will say, well, there's no COVID anymore. It's almost like people are bored now. They feel like COVID-19 is no longer there. But like the doctors say that COVID-19 is still here, and it's going to be around with us for quite a long time, even if the vaccines are now starting to be rolled out. Yeah.
And yes, we're absolutely fortunate that the vaccine will be reaching us soon. And that will be another stride that we're making, in this effort to curb the further spread of the coronavirus. And hopefully that will also help with easing the pressure that the pandemic has put on the various sectors of our health systems and our economy. But that is something to delve into on another day. Dr. Mugula, Timo, thank you both so much for joining me. Definitely would like to have you in studio again in the future to discuss more health-related subjects. As for our viewers, thank you for tuning in. We would love to hear your comments and hear from you, so please do not hesitate to give us feedback. I am Arlana Shikongo, and this is the Namibian's Heartbeat. See you next time.